Welcome to our live webinar on guidance for bone marrow failure patients to protect against coronavirus or COVID-19. This is a critical topic for all of you, and the Aplastic Anemia and MDS International Foundation has always been here to support our patients and families for the past 36 years. Thank you for joining us. My name is Alice Hauk, Senior Director of Health Professional Programs at AAMDSIF, and I will be moderating the presentation today. As we get started, we recognize the generosity of Alexion, Apellis, Genentech, and Jazz Pharmaceuticals, along with our patients, families, and caregivers for supporting this webinar. Today's program will be archived to our website within 2 to 3 business days. You will be notified by email when it is available and ready for viewing. Immediately following the presentation, there will be a question and answer session. Please feel free to submit questions at any time during the presentation. To submit a question or comment, open the Q&A window on the lower part of your screen, type your question in the small text box window, and when you have finished typing your question, hit enter. We will do our best to answer all questions. When asking questions, I respectfully ask that you do 2 things to help us manage incoming questions. First, submit your entire question all at the same time. And second, please do not share private health information in your question. Our speakers cannot answer any specific questions related to your individual health care. Today's presenters are Dr. Mikkael Sekeres, the Director of the Leukemia Program at Cleveland Clinic Cancer Center and Chair of the AAMDSIF Medical Advisory Board, and Dr. Isabel Schuermeyer, Staff Psychiatrist in Psycho-Oncology at the Cleveland Clinic and the Chair of the AAMDSIF Patient Education Council. Welcome, Dr. Sekeres and Dr. Schuermeyer.
Thank you so much. Thanks for inviting us to participate in this afternoon.
Yes, thank you for having us.
Well, I think we should probably get started. Welcome, everybody. Thank you for joining us today. We thought we'd get started with a little bit of background about what we're dealing with. A few months ago, most of us hadn't even heard of coronavirus. It started in the Wuhan province of China and has now sickened worldwide. Over 135,000 people, about 5,000 people have died from this virus. It gets its name because if you look at the virus itself, it has a bunch of crown-like spikes that protrude from its surface, and that's where they got the name corona, corona meaning crown. It started in China, has spread quickly, particularly to areas of the world like South Korea and Italy, and now has spread to other countries. And that's why the WHO is now calling this a pandemic. It has spread around the world. We wanted to answer some questions about coronavirus today and how you, if you do have a bone marrow condition, can best deal with the coronavirus and try to protect yourself from actually acquiring it. I wanted to also place this in context a little bit with other infections that people have had over time. So why is it we're so focused on this all of a sudden? Well, one of the reasons is that we really haven't seen this virus before. So the most common thing we compare it to is the flu. The difference between this and the flu, first of all, is to think about how easy it is to catch this. How contagious is it compared to other infections like the flu? This is conveyed by airborne transmission, which means that somebody can be near you and cough. It doesn't just have to be droplets. In other words, you don't have to actually have contact with fluid from somebody's body to get this. And this is reported by a number called an RO, which is a kind of a reproduction number, how many people catch it from one person. The RO for the COVID-19, that's the virus that causes coronavirus, is 2, meaning one person typically spreads it to 2 other people. To put that in context, for seasonal influenza, the number is 1.3. For something like measles, it's 15. Smallpox is almost 5. So for infections like measles or smallpox, they're far more contagious than the COVID virus is. This seems to be slightly more contagious, however, than something like the seasonal flu. The next question a lot of people ask is, what's the case fatality rate? So of everybody who gets this virus, how many people are likely to die? And this is a bit of a moving target. One of the reasons it's a moving target is that we don't know how many people have it in the world. One of the reasons you've heard so much push about testing people is that that will then inform how many people are actually carrying the virus or have been exposed to it, and that gives us more insight into how many people die from actually getting the virus. Our best estimate so far is that probably close to 1% of people who get the virus will die. This is far more likely in susceptible populations, and you've certainly heard about some of the outbreaks that have occurred, for example, in a nursing home in Seattle. So folks who are older are more susceptible to getting very sick from this virus. And to put it in context, if about 1% of people who get the COVID-19 virus die, about 0.1% of people who get the flu die. And that's why you may have heard some numbers out there that say this is 10 times more deadly than the flu. It is true that more people die from this who are exposed, but we're really not sure what that denominator is to inform that percentage. In other words, how many people in the world actually have this virus, and then how many people actually die from the virus. So what is it that you can do to help protect yourself from getting this virus? Well, you know, this will come as no surprise to you because it's the things that you're already doing when you have a bone marrow condition and are trying to prevent yourself from getting any kind of infection. I've talked to my patients about these precautions, and they kind of look at me like I'm silly and say, yeah, I'm already doing all of that. And I say, of course you are, because you've now been living with a bone marrow condition for long enough that this has become second nature to you. And this will be second nature to a lot of you. It's the rest of the country where it isn't second nature, and that's why people are making a bigger deal about this. So some obvious things. The most common way that a virus gets into our body is through portals into our body. What do I mean by portals? I'm talking about our eyes, our nose, and our mouth. So don't touch anything on your face, if possible, until you've washed your hands or adequately treated them with some sort of alcohol disinfectant. Wash your hands for at least 20 seconds with soap. It's important. The scrubbing part of that is important. It's important to get in between your fingers, and if you can, underneath your nails. And you want to use either soap and water or a hand sanitizer that contains at least 60% alcohol. When you cough or sneeze, this is stuff that we were all taught by our parents when we were little kids. Use a tissue. If you don't have a tissue around, try to cough into your elbow, the crook of your elbow, and obviously you don't want to cough or sneeze onto people around you. Try to avoid shaking hands with people. So I have a little joke that I do with my patients now. Instead of shaking their hands, I give them what I call the corona wave, right? Corona means crown. I make a little crown with my hands and wave at them. The other thing I've seen some of my patients do is they'll give me a corona hug. They hug themselves. So try to avoid touching people. Avoid close contact with people who are sick, and discourage people from visiting your home if they have any symptoms of illness. This is for your safety and for theirs. So we're all going into social isolation mode and trying to figure out how to navigate that. The best thing we can do is to not see people outside of our own families, but sometimes that's unavoidable. Sometimes it's unavoidable because you're going stir crazy being alone. Well, that's okay. If somebody comes to your house, make sure they don't have any symptoms of cold. The ones we think about with coronavirus, the two most common are fever, cough, and then also sore throat as part of cough. If they have any of those symptoms, they are not allowed to visit. If they don't have those symptoms, that's fine. They need to come to your house and wash their hands, and you're not supposed to have any contact with them. Next slide, please. So objects in your house that may have germs, what are the types of things that have germs? Well, these are pretty obvious, things that you touch all the time. Doorknobs, flat surfaces, those are particularly bad places for capturing germs. Light switches, handles, toilets, faucets, laptops, keyboards, cell phone, things you touch all the time We now need to start thinking about getting some of those disinfectant wipes and wiping them down, and also being cognizant of when you touch something like that to make sure you're not touching your face. Avoid travel as much as possible. We may see increasing bans on travel that are being put into place. Avoid crowds and large gatherings, especially in poorly ventilated areas. So at my institution, well, our institution, me and Dr. Schuermeyer, we've banned gatherings of people of 15, that include 15 people. We're actually trying to go entirely to either Zoom or Skype meetings to minimize contact we're having even with our colleagues in the best interest of our patients so that we're not sick and then getting them sick. Try to avoid contact with high-touch surfaces in public places. You can imagine what these are: elevator buttons, door handles, again, handrails, touch screens. And as I mentioned, flat surfaces are your enemy. Try to avoid touching flat surfaces. If you have any questions or concerns specific to your condition, contact your physician, and be aware that facilities like ours are actually screening people at the door, again, for the protection of our patients. So please be patient with folks if you're entering areas and they start asking you questions about if you have a fever or a cough. I promise you it's in your best interest and in the best interest of folks we're taking care of. COVID-19 testing is not as widespread as it should be in the United States. There are some centers that are doing it. Ours happens to be one where running tests every 8 hours, and those tests are being returned to people. What we're told is it's going to be in about 24 hours from that testing. If you have questions about this, some of the best websites to go to are the cdc.gov website. There's also a coronavirus website that the government has put up. For patients who are getting active therapy, so if you've gotten, for example, ATG for aplastic anemia or for MDS, if you've undergone a bone marrow transplant, if you've undergone any type of therapy that's suppressing your immune system, one of the questions that I get a lot is, what should you do about your medical appointments? Well, if you have a scheduled treatment, don't skip that treatment. You still need to get treated for your bone marrow condition. If it's an every 6-month follow-up or every 3-month follow-up, call your doctor's office and say, is this follow-up really necessary? Can we put it off until the active infection rate of coronavirus has passed? Or even ask your medical center if they'll allow you to participate in a virtual visit where you can meet with a doctor from the comfort of your own home. It won't involve getting labs, obviously. We can't get labs over a cell phone, not yet anyway, but it'll at least allow you some contact with somebody without having to be exposed to other patients and, frankly, providers at a medical center. If you are on a neutropenic diet, you continue to follow the same things that you do all the time. If you can, take steps to make sure that you have a 3-month supply of your medication and possibly arrange mail order delivery of your medications. And as you've heard a lot of, be prepared to self-quarantine yourself for up to 14 days where necessary if you do start to develop symptoms that may be consistent with the coronavirus. As I mentioned, there is a website, we have it on this slide here, that you can go to for more information about this. And here are just some other websites as well. Now, I don't know about you, but I've been pretty stressed out listening to this all of the time. It's the only thing I hear on the radio. It's the only thing I see on TV. It's the top alerts that I get all day long on my phone or when I go to websites. And it's caused me to be anxious. Not only that, but not only am I talking to my patients all the time about it, but I'm also talking to my kids, my family, and we're trying to figure out what we're going to do, particularly since we found out yesterday that Ohio closed all of their schools for 3 weeks. So we're going to have a lot of quality time with our kids. So I wanted to invite Dr. Schuermeyer to talk a little bit about how we deal with all of this.
Awesome. Can you hear me?
I can.
Hello? Okay, awesome. Thank you, Dr. Sekeres. And yes, this is a very atypical time. And I must say, I've never seen schools being shut down for 3 weeks in this manner, which is pretty atypical and stressful for many parents. So So let's talk about stress and anxiety. What we know is that human beings, we like certainty. We like knowing what's going on. We like knowing what's coming up next. And when things aren't going the way we like it to go, or the way we expect it to go, we notice it. And certainly this COVID-19 coronavirus situation, that's been pretty noticeable. So part of it is that it's very normal to feel stressed in these types of situations. In fact, evolutionarily, this is a very important protective mechanism. So, and I don't have any slides to refer you to, but if there's two important brain structures to think about. One is the amygdala, and the amygdala is what houses your fear center and your stress and anxiety. And the other area is your frontal cortex. Your frontal cortex is what houses your logic center, your executive functioning, your ability to be rational, reasonable. And the fact of the matter is that when something stressful happens, many times your amygdala just takes over and you become very fearful, very stressed. And what you need to do is have your frontal cortex, that logic center, to take back over. And the reason why we want that to happen is because remaining in that heightened stress situation is really not healthy for a variety of reasons. One is it can affect your brain biochemistry, which can affect your mood. It can make people feel more irritable. You can get angry. You can feel sad. You can have a drop in motivation. There's a whole slew of things that can happen. And so ultimately, when we talk about stress and anxiety, a lot of it comes down to control. And as human beings, we all like having control. And so one of the things that I talk about a lot with my patients is what is it, and my kids, is what is it that we have control over and what is it that we don't have control over? So as Dr. Sekeres and I found out yesterday, the governor of Ohio has decided to shut down the schools in Ohio for 3 weeks. So that is something that we don't have control over. But what we do control is how we're going to respond to that and how we're going to handle it. So one of the big myths is that we control our feelings. We don't control our feelings. Our amygdala controls our feelings. That's that fear center, again, in our brain. But we do control how we respond to our feelings. We also control our health behaviors. So as Dr. Sekeres was talking about, doing the appropriate hand hygiene, that's critically important. Not letting people who have any symptoms of the COVID-19 infection or really any cold getting close to you. So that's important. Other things that we talk about to help people with reducing that sense of anxiety are doing things that will help make you feel a sense of safety. So for some people, it's having a specific type of hand sanitizer that they have in their car and their purse. For other people, it's a specific type of soap that they want to use. Whatever it is, we tell people just make sure that that's what you've got handy. Another really important way to cope with this is to go outdoors. Not saying that you need to go out into a crowded area. In fact, the opposite. We don't want people going into crowded areas, but going outside. A lot of times people, when they start feeling anxious and stressed, they will sort of self-quarantine and not want to go outside. And we know that going outside is critically important for your brain biochemistry, but overall for your health. So just go outside in nature, even if it's just going out to your front porch or on your balcony or whatever. The other thing is, pick up a book, stay away from watching the news. The news is pretty scary. And I'd encourage people to to not focus on it as much. However, do stay informed. So challenge yourself to stay in the present, which is a really hard thing to do. Humans are also planners. We like knowing what's happening next. We like knowing what's going to be going on next week and the week after, and when our kids' spring break will be, for example. We like knowing all those things, and that's hard to do because we don't have control of that. And so you need to try and work to stay in the present. So staying in the present means just focusing on what's going on right now. And then finally, one of the things we talk about is staying connected with your family and friends. And so that may mean doing things more in a virtual setting, kind of like what we're doing right now, which can be challenging, but totally possible. And then certainly if you do notice that you're feeling anxious all the time, do reach out to your healthcare team because they're going to want to know, and they'll know what resources are available for you. And sort of in conclusion, one of the things that I talk about with my patients is that anxiety is a lot like a toddler. It never stops talking. It tells you that you're wrong about everything. And it wakes you up at 3 o'clock in the morning. And so similarly to dealing with a toddler, your toddler is basically, the analogy is your amygdala. You want to get that logic part of your brain engaged to help settle down your amygdala or that toddler and really just look at the facts and what you do control and what things you can do. So with that, I think we're going to go to question and answers, right?
Yes, thank you so much, Dr. Sekeres and Dr. Schuermeyer, for the presentation piece of this webinar. And now we are going to turn it over to questions, and I'll turn over the mic to my colleague, Lee Clark, who will share the questions with you.
Thank you. Our first question is, what criteria should be used for determining who to test? This patient is in Washington State, which is the epicenter of last outbreak, and would like to know what is being used to determine who gets tested.
Yeah, that's a great question, and I'm sure it's not consistent at every place in the country. I would think that if you have a fever and a cough and a sore throat and are acting as if you have coronavirus, that could be a criterion for testing. But remember, there are other viruses that are still circulating. We're not out of flu season yet, believe it or not. There are people who can have common colds like the rhinovirus. So some centers will have kind of a stepwise approach to testing where they'll test for more common causes of the common cold, and then once those come back negative, if a person's symptoms persist, then go to testing for coronavirus. Part of that depends on how many testing kits they have available. It was only until recently that the state of Ohio had 400 testing kits for the entire state. So if it's a resource limited ability to test, yeah, they're going to have a stepwise approach to testing. If there are unlimited resources for testing, then they're going to go to test for coronavirus first.
Thank you. Our next question comes from a patient in England, and this person wants to know what would be the most important thing for patients to let healthcare professionals know if they're not familiar with MDS regarding watch and wait if they were to contract COVID-19.
Yeah, I love that question. So probably everybody on this call right now or either has a bone marrow condition or is close to somebody who has a bone marrow condition. And sometimes that means that we become the educators to folks who aren't used to treating patients who have bone marrow conditions. Part of that education is telling a provider what that means to have myelodysplastic syndrome or aplastic anemia, to say my blood counts are always going to be very low. What you may report to me is actually an improvement over what I usually see. And to say, by definition, that means that my immune system is not functioning as well as it once did or as it should. to tell somebody, you know what, I'm technically in a high-risk group, even if I don't look like I am, so that their attention to you changes, and their concern over symptoms that may indicate a coronavirus infection also changes.
Thank you. Is it known which blood elements will attack viruses in general, and is this the same for the coronavirus?
Yeah, so if we're kind of generalizing all the subtypes of white blood cells, the neutrophils, we always talk about neutrophils and what's your neutrophil count. Those are the subtypes of white blood cells that attack bacterial infections. The lymphocytes are the ones that attack viral infections. But they all work together. So a simple answer to your question is it's the lymphocytes. The more complicated answer to your question is that all of our white blood cell elements work as a team to fight all sorts of infections.
Thank you. Will a daily dose of prednisone make a patient higher risk since it's an immunosuppressant, or lower it because it controls complement in those with extravascular hemolysis?
Yeah, it's another great question. So prednisone is complicated. Prednisone suppresses the immune system. So that means you're more prone to infections like with the coronavirus. What it also can do is suppress symptoms that a person may experience that may indicate an infection. It may suppress cough. It may suppress fever. So it's important to let people know that you're on a steroid like prednisone, because your symptoms won't be typical of other people's symptoms. The second aspect of that question, talking about complement, people who get really sick from coronavirus have a release of chemicals in their body called cytokines that may make the situation worse and may lead to some of the interstitial pneumonias you may have heard about that land people in an intensive care unit. So paradoxically, things like steroids may be used to treat more serious infections to try to tamp down inflammation in some of those cytokines.
Thank you. Our next question is regarding kids coming home on spring break, flying in to visit their parents. The question is, should these students self-quarantine or just keep their distance from those who may be immunocompromised? And the other part was this person's daughter is also coming to visit and uses the New York City subway. What is the best advice on how to handle this situation?
Well, I hope the daughter's not using the New York City subway to get to Florida, because I don't think it goes that far. This question in particular really hits home because I went and picked my son up from the airport last night because his college basically closed down its dorms for the next 3 weeks and possibly the next semester. And the first question that we had among our family is, gee, is he about to introduce infection to us? He comes from an area outside of Philadelphia that seems to be endemic. So I don't have any great answers for you on this one, unfortunately. One of the aspects of the coronavirus in China was that 75% of people who were infected were in family units. They were close with each other. It's hard to self-quarantine when you're living in the same house with somebody else. There's also an incubation period aspect to this. It's 14 days we have people quarantine themselves, but people can be asymptomatic and still transmit the virus for 5 days. That's a long time, and that's one of the reasons why this seems to be spreading even faster than the flu. The flu can only be transmitted for about 48 hours before you have symptoms. So I'm talking a lot, which means I don't know the answer to this, and we haven't figured it out in our own house what to do with my son. We're trying to be sensible about washing our hands a lot, washing down surfaces a lot. My son has a tendency to go into his room, so that kind of helps that he's a self-quarantiner from the get-go. All you can do is your best. You're going to welcome your kids home, and college campuses don't want them. So we have to practice that kind of good hygiene at home as best we can, understanding it's hard to do that in your own house.
Thank you. What are the initial symptoms of the virus? What would a case present like on the initial days of symptoms? Is it possible to have the virus without a fever?
Anything is possible. So the most common symptoms are fever, sore throat, and cough. But as I mentioned, the virus can be transmitted without any symptoms at all for about 5 days. The one thing that doesn't seem to be as associated with it is all the kind of stuffy nose, sneezing, runny nose that we associate with a lot of other viruses. Doesn't mean you can't get that. It's just less common. So your suspicion for the coronavirus should be higher in the setting of fever, cough, and sore throat.
Thank you. Do you have any recommendations for any type of special cleaning of fruits, vegetables, and other unpackaged foods from the grocery store?
Another great question. And again, you're hitting home. My 11-year-old was asking this question last night of us. How can we be safe buying stuff from the supermarket? I would do the normal washing that you do with fruits and vegetables, right? We always wash these down. If we're washing our hands for 20 seconds, we should be washing fruit and vegetables for at least 20 seconds as well.
Thank you. Are there any special precautions for PNH patients who are being treated with complement inhibitors, being that they are more susceptible to infection or meningococcal disease?
Yeah, saying it's another great question. We're all engaging in the same precautions. There's nothing special that I would advise for somebody with PNH versus aplastic anemia versus MDS versus leukemia. It's social isolation, it's washing down surfaces, washing your hands frequently, not touching anything on your face. But there are no special medicines that you can take to prevent this from infecting somebody.
Thank you. Should patients be wearing a mask if they plan to go out and they're going to be in groups of people?
Yeah, fabulous question. There are masks and then there are masks. So the best masks, and there are the N95. Those are ones that are actually fitted to your face. And those are ones that are actually the ones where you put it on, you say, gee, it's kind of hard to breathe through this. Well, yeah, it's because you're breathing through a really good filter. Those masks both prevent you from getting an infection and also prevent you from transmitting an infection. And those are the ones that healthcare professionals need to use. The masks that we can typically buy at a CVS or Walgreens or Target, you know, sometimes you call them the surgical masks. They either have loops that go over your ears or things you tie in the back, are not effective at preventing people from getting the virus. They're good at helping to prevent you from transmitting the virus, right? If you cough or sneeze into a mask, you're not going to be aerosolizing that stuff as much as you would have. But I have to not really laugh a little, but kind of shake my head a little when I look around and see all these people in these flimsy masks that really aren't helping.
Thank you. Is there a difference between the susceptibility for the coronavirus different between patients with bone marrow failure and those who do not have bone marrow failure?
You know, that's a question that I asked an infectious disease doc and couldn't get a straight answer because I don't think people have studied that well enough. You're more susceptible to infections in general. If you have something that compromises your lymphocytes, so you've gotten ATG, you've gone through a bone marrow transplant, you're on steroids, I think that makes you more susceptible to getting this because your lymphocytes, the primary white cells that fight this, are compromised. More importantly, the reason we focus so much on folks who are older or folks who have compromised immune systems is that it's not that you're necessarily more likely to catch this. You might be. We don't know for sure. But it's that once you catch it, it can be more serious because you don't have the defenses to get rid of it.
Thank you. This question comes from a family member whose father is 70, high risk MDS AML, and is due to start a course of Vidasa injections. Are there any additional considerations that need to be given with the virus?
It's a great question and one that we're struggling with as we here at Cleveland Clinic are starting patients on therapy. No more special considerations than anything I've talked about trying to prevent getting infected with the virus. A question I would ask is how urgent is it that your dad gets started on the azacitidine? I would say for somebody who has higher risk MDS, it's more urgent to get that under control. For somebody who has lower risk MDS, you might be able to defer it for 4 weeks. And maybe by that point, some of this has passed. Now, I say that because I'm an optimist. What I keep hearing is that 4 weeks isn't going to be enough for this to pass. It may be 8, 12 weeks. We probably won't see the peak of this until April or May. If it can be deferred, I would defer it. If it can't, and often it can't be deferred, then go ahead, because getting control of the MDS is really important.
Thank you. This is coming from this is a post-transplant question. This person had a transplant a few years ago and has normal blood values. Would we still consider ourselves high risk, or just take precautions as a healthy adult?
Yeah, well, first of all, congratulations on being a few years post-transplant. That's wonderful. I would think transplant, even though you're out of the real danger period for when you're under super duper precautions, the first 100 days, the first 6 months, the first year post-transplant, I would still consider yourself high risk. I don't know enough about your personal situation to know if you have graft versus host disease or if you're still on some degree of immunosuppressants. So I would err on the side of caution and consider yourself high risk.
Thank you. Is it true that women are more asymptomatic?
Ooh, I hadn't heard that one. I have heard that kids are much less likely to get it. So in this entire event that happened in China, I think there were about 350 kids who were infected, and only one went to the hospital, and probably because he was dehydrated. So kids seem to do okay with it, other than the fact that they're carriers, so they're going to give us the virus. I also heard that African Americans are much less likely to get it, and it has to do with how the virus is taken into cells. But I hadn't heard that about women.
Thank you. This is a question regarding treatment. What treatment is available, and would this just be for severe cases? And how would this impact bone marrow failure patients?
Another great question. So there are some treatments that are being tried, one of which is actually a protease inhibitor. It's a drug that's used for HIV. Remember, HIV is a virus, just like this is a virus. It's been used in China. I've heard anecdotally some reports of successes, but it's really being reserved for people who are in intensive care units and on breathing machines. So the sickest of the sick.
Thank you. Are there contingency plans in place for treatments like Soliris and Ultomiris or other treatments for patients?
I'm not exactly sure what you mean by contingency plans.
For instance, for patients being able to go in and get treatments through hospitals and facilities.
If you need to get a treatment, get a treatment. Facilities, if you are dependent on treatments to control your bone marrow disorder, then you should be getting your treatments. That's more important than avoiding a public place like a hospital.
Great, thank you. Is there a different risk for MDS, high risk versus low risk?
Another great question. High risk tends in general to have a more compromised immune function than low risk, so I would think that it would be slightly higher risk. But I've seen low risk folks who have impaired immune function. I've seen high risk folks who have preserved immune function, so it kind of depends.
Thank you. Can the coronavirus be transmitted through a blood transfusion?
I don't know the answer to that. I heard no, but I don't have enough data to, I want to answer you truthfully, and I don't have enough data to support that.
Thank you. This comes from a wife whose husband is getting ready to possibly have a bone marrow transplant in the next few weeks. They're concerned about moving forward with the transplant. Do you have any suggestions on how to proceed, or what types of questions should they be asking before making a decision to move forward?
Yeah, we're struggling with this exact question ourselves with our patients going to transplant. What I would do is check in with your transplant center and ask what they're doing about this virus and if they're screening patients beforehand. Many people can't wait for a bone marrow transplant, right? It's you have something that is severely compromising your bone marrow function. This represents a potential chance of cure. You've been waiting months to get to this point to finally get to the transplant, and then this virus hits. So I think some transplant centers are formally testing people before they go through with the transplant. Others are assessing your symptoms, and if you don't have the symptoms, they're giving you the go-ahead for transplant. So make sure you check in with your individual transplant center and see what their process is. They will have some kind of process for this.
Thank you. If you are diagnosed with the coronavirus once, is it possible to get it again?
I just asked this question a couple days ago of an infectious disease doc. You should have some immunity to this version of the coronavirus once you are infected with it. Now, just like with any other virus, viruses can change over time. This is a pandemic. So if people are talking about it circling back around the world, if it's the same virus, you should have immunity to it. If it's altered as it's passed from person to person to person, that you may not have as much immunity to it. And that's one of the challenges with this virus, right? With flu, a lot of people have had the flu before, they've had flu vaccines before, so there's some what's called herd immunity, meaning not everybody gets it, and therefore not everyone can pass it along. This is new. We don't have herd immunity. That's why it's being passed along so much.
Thank you. Would it be helpful in any way for patients to receive the pneumonia shot?
Pneumonia shot, if you're due for one, is always a good idea because, like I said earlier, this isn't the only infection out there. We're still in flu season. You can still get rhinovirus. You can still get bacterial infections. So if you're due for a pneumonia shot, get the pneumonia shot, but it will not protect you against coronavirus.
Thank you. I'm filtering through, so we have some of the same questions. Isabel, Dr. Schuermeyer, do you have any suggestions for patients who may be having difficulty trying to explain to family members or friends their concern about attending family functions or doing things normally? Is there a best way for patients to try to explain their heightened fear right now of becoming affected by the virus? Isabel, you're on mute. Dr. Schuermeyer, thank you.
Sorry. All right, I think I'm unmuted now. My apologies.
You're good. Thank you. Thank you.
So yeah, that's something I hear a lot about from many of my patients, because that can be a little bit awkward sometimes. But honestly, what I tell folks is just be kind of upfront about it and say, listen, I'm really concerned about my health. And this can be a really critically important time for me to keep my health, my priority. And so, I'm going to be limiting what I do and the situations that I'm in.
Thank you. Dr. Sekeres, is there any change for patients, the protocol for when patients should be concerned about a fever?
There really isn't. If you have a fever and you have a bone marrow condition, you should be contacting your doctor's office and asking somebody whether or not it's your immune system is compromised enough that you need to go to the hospital and get antibiotics immediately. That's true at any time.
Thank you. Is there any danger of running out of blood supplies?
There is a danger of a shortage as people are not gathering publicly anymore and are going more into social isolation. They're not going to blood centers and donating blood and platelets anymore. So there is some risk that those blood supplies will not be as robust as they usually are. I will tell you, I think hospitals and medical centers are really good at prioritizing that and almost all of the time, our patients are prioritized for those blood products.
Do we know if this will follow influenza and have different strains annually?
Yeah, another great question. Don't know yet. There's a lot of speculation about that, but people don't know yet. The one difference with influenza is seasonal. And what I've read is that this is not likely to be seasonal. It's likely to be year round. But as more of us get exposed to it and build up immunity to it, it won't be a pandemic like it is.
Thank you. Could you please explain the relationship between lymphocytes and neutrophils relative to the virus?
Yeah, once again, lymphocytes are predominantly the subtypes of white blood cells that are responsible for fighting viral infections. Neutrophils are more responsible for fighting bacterial infections. One special aspect of lymphocytes is that they can have memory. They're actually called memory T cells, memory B cells, and those are the ones that when you're exposed to a vaccine, remember what that vaccine looks like. So if you actually get an infection with something like measles, they get rid of it real fast. What I have heard, and again, I haven't validated this with data, is that vaccines are being developed for coronavirus, but they probably won't be on the scene for another year and a half.
Thank you. This pertains to children. Are children less likely to be affected by the virus? And if so, does that mean that they are not carriers either?
Great question, and gives me an opportunity to clarify what I said earlier. So what I've heard is that children are as likely to get infected with the virus, but not as likely to get sick with the virus. So they are carriers, just like they're carriers of everything that makes us sick. But they, like I said, in China, there was only one kid who ended up going to the hospital with this. One kid out of all those people infected. That's amazing. So our kids aren't going to get sick, but they can give us the virus.
Thank you. As far as, we have another question regarding PNH and patients being treated with Sekeres. There is information that there is a current clinical trial that is happening with Sekeres. How does this affect current PNH patients?
Yeah, I'm sorry, I don't know the answer to that.
Okay.
If I would check with your local medical center to see how this is impacting clinical trial operations. One way that we're dealing with this here is clinical trials require that patients come to a medical center regularly. So for example, that they be seen weekly or every other week or once a month. And a lot of medical centers, ours included, is trying to minimize the number of patients who come into the center, which we consider a public place. So I'm actually the vice chair for clinical research here in the Cleveland Clinic Cancer Center, and we just sent out an email a couple of hours ago saying if it's in the best interest of the safety of your patients to not come for a visit, don't have them come for a visit. So some centers are willing to work with patients even on clinical trials to ensure those patients can enroll to a clinical trial, but also maintain their safety during this pandemic.
Thank you. Do we know if blood supplies are now being checked for the virus?
I don't know the answer to that. It's a great question.
Okay. Thank you. Our next question is regarding for patients going out to have their labs done. The question is, are labs taking the same precautions such as hospitals? And what is the recommendation for that?
Yeah, well, they should be. When you go to a lab, when you go to a hospital, they should be practicing universal precautions. They should have some hand sanitizer that's available for you to use. The folks who are approaching you shouldn't be sick. They should be using sterile technique for drawing blood. So I say should, and hopefully they are at each one of these centers.
Okay. Thank you. Do you have any advice for newly diagnosed patients who maybe have not started treatment yet for MDS?
That's a really broad question. I have a lot of advice for people with a new diagnosis.
Would it be safe for them to start treatment, or should they? What is the advice there for patients who are looking to maybe begin treatment but have not started their first treatment yet?
Yeah, it's a great question. So it depends on the treatment you're getting. If you have a lower risk myelodysplastic syndrome and you're starting treatment with an erythropoiesis stimulating agent like Procrit or Aranesp, go ahead and start the treatment. This isn't going to affect it at all. If, on the other hand, you're starting a treatment that may lower your white blood cell count, then I would check with your doctor about how important it is that you start that therapy right now as opposed to waiting a month or two.
Thank you. Most patients watch their white blood cell levels. How low should white blood levels be before patients start to self-quarantine?
That's a really good question. We define neutropenia, so immune system that's pretty significantly compromised, as a neutrophil count of less than 500. That's generally the point at which we start to think about putting patients on prophylactic antibiotics and ask them to start to initiate broader precautions. In this coronavirus era, all of us should be doing those same precautions. So I wouldn't look to a specific white blood cell count. Once the coronavirus threat has lessened, I don't think it's ever going to completely go away, then we usually use a neutrophil count of about 500. But listen, if your neutrophil count is 560, treat yourself to going on the same precautions. It's close enough.
Do we know if the coronavirus can cause sepsis?
That's another great question. The coronavirus can infect the lungs and can cause a cytokine release that looks for all the world like sepsis. So I don't know if technically you would call that sepsis, or gee, it just looks a heck of a lot like sepsis, but it can get really serious.
Thank you. Does cyclosporin affect viral defense?
Yes. Cyclosporin suppresses the immune system and it affects the lymphocytes. So yes, it puts you at higher risk.
Okay, thank you. There's a question regarding supplements. Are there any extra supplements that patients can use to boost their immune system?
No.
Okay.
That's my kids taught me about soft nose and hard nose. That's a hard no. In fact, there was just an article in the New York Times about 2 days ago that addressed this exact question and talked about whether there are any types of supplements, vitamins, medications that have been shown to improve the immune system, and they gave a hard no in that article also.
Okay, thank you. Isabel, Dr. Schuermeyer, what about for support groups and things? Do you think that support groups would be something that are helpful for patients during this time, or any other resources for connecting with patients for support?
So I do think support groups can be helpful, although I would suggest that they be done virtually. So I can tell you that there are other support groups that I know of that have decided to change their format. Instead of meeting in person, are now changing to doing it all via electronic format. And so that can be very, very helpful, especially when people are trying to socially distance themselves. But I would do that in a safe manner.
Thank you. Are there any specific instructions for patients if they feel they need to be tested, if they're going to their hospital? Should they call ahead? Are there any those type of particulars that would be recommended for patients who think they've been affected in going to be tested?
Yeah, that's a great question. So some hospitals have identified specific areas where people who think they may have coronavirus should go to get tested so that they're separated out from the rest of the patient population who's there. I love that idea. Call ahead, see if there's a specific place that patients should go. Some hospitals are even doing kind of mobile or drive-through testing areas that may be more convenient for you.
Thank you. Our next question is regarding, here we are. This patient is looking to go get a second opinion in April. All of their counts and everything are stable. Would it be recommended that they reschedule?
That's a great question. If it's not an urgency, let's say you've been given a diagnosis of lower risk MDS and your initial doctor has said your blood counts are normal, not seeing worrisome things here, you 100% owe it to yourself to get a second opinion. But you can delay it. So, well, I would do myself a service and wait, an extra month or two, see where things settle out before you go for that second opinion.
Thank you. Will a wider use of GCSF be used for MDS patients?
It's another great question. So GCSF is a shot that increases the white blood cells and particularly the neutrophils. There have not been great studies of this drug or its longer acting form, Neulasta, in MDS patients, and therefore most of us don't recommend it for treatment of low immune systems in MDS.
Great, thank you. How long does the virus live on surfaces?
Say that one more time. How long does the virus?
How long does the virus live on surfaces?
Oh, that's hotly debated right now. The initial reports came out and said it's, up to 8 hours, and now there are people saying it depends on the surface and it could even be days. It's a moving target. I haven't seen something that's conclusive about that yet, but I've seen these huge ranges.
Okay, thank you. That looks like that is all of the questions that we currently have. Any other bits of advice, Dr. Sekeres or Dr. Schuermeyer, for patients?
The one thing I'll leave you with is that for most people, this is not a serious infection. 80% of people who get coronavirus, it's kind of like a cold. I mean, nobody likes getting a cold. It stinks, but it doesn't kill you. But there is a small percentage of people for whom it can be deadly, and that's why everyone is going crazy about it. And this is what my wife and I have told our kids, because they're anxious about this, right? And they have said to us, we don't want you to die. Well, we're not planning on dying. Who does? But for people like us, we are fortunate to not have other medical conditions. We're not at higher risk of dying, and they aren't at higher risk of dying. But heck, we don't want to catch this and then give it to my mom, right? Who is in a higher risk group because my mom is a cancer survivor and she's over the age of 65. So for most people, there's a lot of information about this. There's a lot of anxiety around this. For most people, it won't be a big deal, but we're worried about the people for whom it will be.
And Dr. Sekeres, could you just address again quickly about the traveling for patients if they're needing to fly to go take care of family members or those type of precautions for patients? Yeah.
Bottom line is if you can avoid it, but sometimes we can't avoid it. And if you can't avoid it, and you have to go onto a plane, I would bring some disinfectant wipes with me. I would touch nothing. I would wipe down everything I'm going to come into contact with on that plane. I would see if I can be seated in an area of the plane where there aren't a lot of other people, and a lot of these planes these days are emptier than they usually are. That's all you can do. You can only do so much, and hopefully it'll be okay.
And we did have another question that came in. For an MDS patient who also has COPD with the coronavirus, would there be a difference in the hit to the lung system?
Yeah, I think the answer to that is yes. And it's not that you're necessarily more susceptible to catching it, but if you get it, it could be much more serious.
Okay, thank you. Alice, I'm going to turn it back over to you.
Thanks, Lee. And thank you, Dr. Sekeres and Dr. Schuermeyer, for sharing your time and expertise with us. This was very much appreciated by the many participants we had in the webinar and those who will be viewing it online afterwards. If you would like to watch this webinar again at a later time, it will be available on our website within 2 to 3 business days. and the slides from today's webinar are on our website for viewing or downloading as of today. AAMD-SIF will continue to provide timely updates about COVID-19 and answer your questions as quickly as possible. By registering for this webinar today, you will receive email announcements from AAMD-SIF regarding upcoming webinars and any new information posted on our website. If we were not able to answer your question today, or if you think of a question to submit afterwards, you can send it to us at any time in 3 ways. You can send an email to us at help@aamds.org. You can call the AAMD-SIF helpline at 800-747-2820, extension 2. Or you can submit a question on our Facebook page at www.facebook.com/AAMDS. On behalf of the Aplastic Anemia and MDS International Foundation, thank you for joining us today and making us your resource of choice for information on bone marrow failure diseases. The AAMD-SIF Medical Advisory Board and our staff are here to help you and your family as we have for the past 36 years. This concludes today's program.